Hello my geniuses, welcome to another parasitology video. Today it is your great science tutor Lorenzo. I'll be treating what we call Giardia Lamblia, or we call it Giardia Duodenalis or Giardia intestinalis. So we'll be talking about how this parasite causes Giardiasis. So we want to know how it causes this infection. So if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. You can also scroll to my playlist to watch other parasitology videos so that you will understand how these parasites, whether it is from protozoas, whether they are viruses or bacteria, how they cause what infection. And if you want me to make a video for you, write it down in the comment section and I promise I'll make that video for you. So let us jump right into the video. So in this video, we'll be talking about the protozoa parasite called the Giardia Duodenalis or Giardia intestinalis or the Giardia labia. So this flagellated parasitic protozoa, what happens? They colonize the intestine. It's usually the small intestine. When they colonize the intestine, they cause a diarrhea condition called the Giardiasis. So they are flagellated parasitic protozoas that enters our mouth and colonizes themselves in the small intestine. So when they colonize themselves in the small intestine, what happens? They absorb the nutrient needed for absorption of food. So the intestinal juice and the pancreatic juice, they absorb them, they encyst themselves, and once they encyst themselves, they colonize there and they are passed out to the feces, but they live for a short time and spend their life cycle in the small intestine. Now, one thing you have to know, there are 50 different Giardia species, but 5 are validly removed from them. 5 species. You have the one in mammal, the Giardia almoris. You have the one in birds, the Giardia Duodenalis or the Giardia Protozoite, and you have the one in amphibians, and the one in amphibian is Giardia Giardiasis, and you have the one that affects human, which is Giardia labia or Giardia Duodenalis or Giardia intestinalis. So now it was discovered by a German scientist called Anthony van Leeuwenhoek in 1681 when he isolated it from his feces, and since then it has been a worldwide GIT infection. So also one thing you have to know, that it is transmitted to fecal to oral route, So when an animal can drop it to his feces, or a human can drop it to his feces, from there it can be taken, or anyhow it gets to the oral to another person's, then the person gets infected. Now, since you know that, it can only affect human and animal, which you call zoonotics. So when it affects human can drop it to the feces fed by animals, or drop by animals and get inhaled, or anyhow it gets to human, so it's affecting the two people. It's a cosmopolitan disease, but also occur in warm climates, and children are most susceptible. So one thing you have to know, that this is a GIT infection that colonizes the small intestine only. It's non-invasive, so it only colonizes the small intestine, and when it colonizes, it causes a diarrhea condition called Giardiasis. Don't forget it. So next is the taxonomic classification. So let's see the hierarchy of this Giardia species. So remember your hierarchical classification on your taxonomy, which is the kingdom, phylum, class, order, family, genus, species. Kingdom, phylum, class, order, family, genus, species. So what is their kingdom? They come from kingdom Protista, the Protista kingdom, or kingdom Protista. The next one is phylum. What phylum do they belong to? They belong to phylum what? Metamonada. They belong to phylum Metamonada. So kingdom, phylum, class. What class do they belong to? They belong to class of what? Zoomastigophora. So kingdom, phylum, class, order. What order do they belong to? The order they belong to is Diplomonadida. So remember, the kingdom is Protista, the phylum is Metamonada, the class is Zoomastigophora, and the order is Diplomonadida. So the next one is family. What family do they belong to? The family they belong to is what? Hexametidae. Don't forget Hexamitidia. So that is the family they belong to, Hexamitidia. So the next one after family, we have the genus. The genus is the Giardia. The genus is the Giardia. Why the species can be Duodenalis, Intestinalis, or the Lamblia. So hope you understand the genomic classification of the Giardia lamblia. I told you that the Giardia lamblia colonizes the GIT part, or which is the small intestine, and causes what? Giardiasis. Don't forget. Next is the morphology of the Giardia lamblia or the Giardia duodenalis. One thing you have to know that it exists in two stages of the life cycle, which is the trophozoite form, which also called the active feeding form, or you call it the cyst form, which is the infectious or the dominant form. So the first one is what? The trophozoite form, which is the active feeding form, and the next one is the cyst form, which is the infectious or dominant form. So the trophozoite is the active feeding form, which takes nutrients from the intestine and multiply, while the next one is the cyst form, where it can store itself for a long time until it affects the next person. Now the trophozoite form, what is the shape of the trophozoite? The trophozoite is just like a pear shape or a teardrop like shape. Don't forget, a pear shape or a teardrop like shape. Now what is the size of the trophozoite? It's about 10 to 20 micrometer long and 5 to 15 micrometer wide. 10 to 20 micrometer long, 5 to 15 micrometer wide. The next thing, that how does it locomote? How does it move from one place to another? It uses a tumbling motion using 4 pairs of flagella, which is 8 in number. 4 pairs of flagella, 8 in number. Don't forget. The next is now, how many nucleus does it have? It has 2 nucleus, just looking like an eyes. So it has 2 nucleuses. Just like a nose, it has a ventral sucking disc. Which it's used to latch itself in the wall of the intestine. It also have an axostyle and a median body, which it helps to support its internal structure. But one thing you have to know, it lacks some cell organelles needed for cellular morphology, which is what? It lacks the mitochondria, it lacks the Golgi body, but there's a presence of a microtubule, which is used to multiply. Don't forget. So the next is the cyst, or the infectious or the dominant form. Now one thing you want to know about the cyst form is that now it has an oval shape. While the trophozoite has a pear shape. What is the size? The size is about 8 to 12 micrometer long. And about 7 to 10 micrometer wide. 8 to 12 micrometer long and 7 to 10 micrometer wide. Don't forget, oval shape, 8 to 12 micrometer long, 7 to 10 micrometer wide. While for the trophozoite, they have 10 to 20 micrometer long and about 5 to 15 micrometer wide. Compare both of them. Now, trophozoites have 2 nuclei that look like your eyes. Now why the cysts have about 4 pairs of nuclei, they double the number of the trophozoite, and everything they also have a ventral sucking disc, which is doubled. So everything about the trophozoite, it is doubled in the cyst. It is doubled in the cyst for a reason, so that when they are released to the external environment, they can stay for months until they are picked up by an animal or a human. One thing you have to know, that for the cyst-like form, it is double that of the trophozoite form. The trophozoite can only stay in the intestine, it can only live in the intestine. So when it forms a cyst, the cyst has a double membrane that shields it in the external environment when it is secreted outside to the open. Don't forget. It is very easy. So we have talked about the introduction, we have talked about the taxonomic classification, now we have talked about the morphology. So the next is the contamination. How can it be transmitted? By exposure to this Giardia species. First of all, it might be through contaminated food and water. If it ingests contaminated food or you drink contaminated water, it can be passed on to a healthy host. The next one is fecal to oral route, feces from an infected person or an infected animal, and an animal taking it, or a person mistakenly. So it can also be transmitted. Body to body contact through body secretion can also transmit the cyst. The next one is through zoonotics, maybe an infected dog or a beaver passing this infected cyst around. All this can be a way it can be transmitted. But one thing you have to know, you can only transmit the cyst. The cyst is the other part of the life cycle which can exist outside the host. The cyst is the only part that can exist outside the infected person. Don't forget, because first of all, if you ingest the cyst, okay, let me take for instance, the cyst has been passed on, it's in the feces and it's taken on by an animal. What happens? It travels to the what? It travels through the mouth, through the digestive system. When it passes through the stomach, in the small intestine, especially the duodenum, what happens? Now, it does what? Due to the presence of digestive enzymes and acid, it exists. Like now, it exists, or what happens? It the cyst opens. We call it excistation. It opens, and when it opens, it transmits and becomes a trophozoite. First of all, it is a cyst that was ingested. Then when it gets to the small intestine, due to the help of acids and digestive enzyme, excistation occurs, whereby the cyst now exists and then becomes a trophozoite. Now the trophozoite, due to the presence in the small intestine, the trophozoite have a ventral sucker and what? Two nuclei. So the ventral sucker latches on the wall of the intestine. The ventral sucker latches on the wall of the intestine so that it will not fall off. So when it latches on the wall of the intestine, it begins to replicate by binary fission. So it begins to divide, continue dividing, and become plenty. So when it stays in the small intestine, because it's in the small intestine, it stays for a long time, but it cannot penetrate the small intestine. It cannot penetrate. It only stays in the lumen. And what in the lumen? What happens when it stays in the lumen? It now changes the structure, infects the intestinal mucosa, thereby disarranging and spoiling it. Now when you damage the wall of the intestinal mucosa, what happens? Absorption will be what? Hindered. Now when food, remember that absorption occurs in the small intestine. So when there's structural damage to the villi of the small intestine, because part of the clinical correlation here is villi atrophy, the villi can be what? Damaged. The cells of the villi can be damaged. When the cells of the villi are damaged, absorption will be hindered. That is one of the pathogenesis here, is what? Malabsorption. Absorption will be hindered because the trophozoite latches on the wall of the small intestine and produce so many trophozoite that now disarrange and destroy the structural integrity of the intestinal mucosa. Now when they latches on and they produce too much, what happens? Now they travel towards the large intestine. Don't forget, excistation occurs due to the presence of what? Acids and what? And digestive enzyme. So excistation occurs whereby the cyst exists and give out the trophozoite. Now it is now passed through down to the large intestine. In the large intestine, the presence of also mucus secretion and presence of the large intestine enzymes and enzymes around the large intestine cause what? Encystation. Now don't forget, it was a trophozoite. At first it was a cyst. They open up to form a trophozoite. Now after the trophozoite passed from the small intestine to the large intestine, now it also acts on by the proteases, pancreatic proteases in the what? Large intestine, and also some mucus secretion. Then encystation occur, because anytime the trophozoite or the Giardia labia senses a harsh environment, it encysts. But when it sees some digestive enzymes, what happens? It exists. So it opens up in the small intestine, usually in the duodenum and the distal part of the ileum, and it exists in the large intestine due to the harsh weather or due to the harsh condition in the large intestine. Then when it exists itself, what happens? It is passed out through the feces. It is passed out through the feces, and this double layer membrane, when it is passed out into the feces, it stays in the feces until the host takes it in through the route we have talked about. So don't forget, it is entering as a cyst. It latches on the small intestine, disarrange and causes structural integrity in the small intestine, damaging the intestinal mucosa, the villi and the microvilli that is needed to what? To allow absorption, causing malabsorption. So there will be no absorption there, and no nutrients can be absorbed into the small intestine. So what happens? After they prevent it, what happens? They enter into the large intestine and encystation occurs. And when encystation occurs, they are released to the what? Anus, as feces. And these feces, they store for a long time. So the cyst can, or the encystation of the cyst can survive outside for a long time. So it's very, very easy. So hope you understand, because the life cycle is very, very important for exam. Now the next thing we're talking about is the pathogenicity. What is the pathogenicity? When a healthy host takes it in, what will happen? So first of all, is malabsorption. Malabsorption, it will not, no nutrient will be able to be absorbed due to the loss of structural integrity of the intestinal mucosa. The villi are damaged, so villus atrophy can occur. Villus atrophy can occur that leads to malabsorption. There can also be what, steatorrhea, because first of all, fatty food will not be absorbed. Fatty food will not be absorbed. You will always see yellow like feces coming outside, so there will be yellow like feces, steatorrhea, villus atrophy. Now the stool will be smelling. The stool will be what, smelling. And there will be what, diarrhea, which means the food will have less contact time with the what, small intestine, because there's no absorption. So all the food that enters will be coming outside. There will be abdominal discomfort, there will be bloating, there will be abdominal cramps, flatulence. All these abdominal abnormalities will occur due to what, malabsorption. So again, what happens due to decrease in nutrients entering into the body? What happens? There will be reduction in growth and development of tissues. Don't forget. So this is the pathogenicity. Don't forget. Next is the diagnosis. So how do you diagnose Giardia labia or Giardiasis? So how do you diagnose it? So we have, usually is it 4 to 5 methods to diagnose it, but one is the most used, because sometimes it can occur in acute condition or in chronic condition. So Giardiasis, or the organism Giardia labia, can be detected. First of all, you can do a stool microscopy. A stool microscopy, 2 over and what, parasite what, examination. Well, now what is a stool microscopy? You are getting what, either the trophozoite or the cyst. The trophozoite is gotten when there's diarrhea stool, when the stool is watery. You can get the trophozoite from there, and you can get the cyst when the stool is semi-solid, which means it has lasted for a long time, because trophozoite cannot last outside the body for a long time. But this is not really that specific. It's not that specific, because you need visualization. Again, the sensitivity is quite reduced, about 75 to 80%, and you only do it for acute what, condition. And you also try it for 3 to 5 times. 3 to 5 times. The next one is what, stool antigen detection. The stool antigen detection, this one is what we call using an ELISA or immunochromatographic what, test. Immunochromatographic test, or you call it the rapid test. Now this one is used to check for what? Is used to check for the what, Giardia specific antigen. The Giardia specific antigen. So now this is more sensitive than the stool microscopy, so it's usually used more than, it has a good specificity and sensitivity more than the stool microscopy. So you use the kit, the ELISA kit or immunochromatographic rapid test kit to determine this. But here you are checking for the what, the Giardia specific antigen. Now the next one you will do is what, you are using your PCR, the polymerase chain reaction. The polymerase chain reaction. Now this PCR test is used to check for the DNA, and this one gives you 100%. You are checking the DNA of the Giardia labia pathogens. So when you are checking it, it gives you a high detection ratio. But you do this for usually chronic what, conditions. When the Giardiasis is in its chronic condition, causing maybe malabsorption specifically, but if it's causing at least diarrhea, it might not be in its most chronic condition. So the next is the treatment. How can it be treated? It can be treated what, pharmacologically, and also by other supportive measures. Pharmacologically, you can use what, metronidazole. Metronidazole is commonly used in this case, and you treat it for 5 to 7 days. The next one, you can use tenidazole too. Tenidazole is also used here in supplementing for metronidazole, because it has fewer symptoms. For children, you can use what, nitazoxamide. You can use nitazoxamide for children specifically, and you take them for like a few days too. So you either use metronidazole, you are using tenidazole, or nitazoxamide in children. So now for supportive measures, due to constant diarrhea, you have to rehydrate the patient, because the patient will have lost a lot of water due to constant diarrhea. The next thing you will do here is, anybody, you treat every person that come in contact with the infected person. So treat everybody. No vaccination is needed, but just treat everybody that have come in contact contact with the patient, so that there will be prevention of what, reinfection. So treat everybody that come in contact with the person, burn every clothes that was used by the infected people or patient. Now with this you can eliminate the cyst that can be that with this you will have eliminated the cyst that could have come in contact with other patients, or to prevent reinfection over and over again. For preventive measures, now what do? You always wash your hand before and after going to the toilet to prevent fecal to oral contamination. You can also boil waters, or make sure that the waters are some water guided treatment are done to the water before they are drinking, to prevent contamination by water. The next thing you will do is that you have to burn off all contaminated clothes or any garment that has been used by the infected person. Next here is that also contaminating food, especially before food are cooked with contaminated water, you should also screen and make sure that they are properly treated before they are eaten. Also educate the caregivers and the children around the effect of the cyst, and to guide themselves anytime, also to guide themselves to prevent what, infection. The next thing again, proper sanitation and proper hygiene can also help to prevent reinfection. This is very important. It is very important. So the mnemonic here we use to understand, just to summarize what we have just said, is Giardia. Like I said, what is the Giardia? Giar, Giar, Dia, Giardia. What is G? G is the Giardia Duodenalis, or Giardia Lavia, or Giardia intestinalis. Now what is I? I is ingesting the cyst, so you have to ingest the cyst first, so you have to ingest the cyst first before any of this can happen. So the next one is A. A is attachment, so they will use their ventral sucking disc to attach. That is A. Now when they attach, what happens? Now AR is reproduction. They will reproduce by what? Binary fission. They reproduce by binary fission. The next one is D. D is diarrhea, which is diarrhea condition whereby the stool will be smelling greasy due to what? Steatorrhea. Then what will happen? There will be bloating, flatulent, all of them due to the presence of diarrhea. Next is I. I is immunoassay. Immunoassay is used as a great tool for diagnosis. So remember I said you can either do a stool microscopy. After a stool microscopy, you can do a stool antigen detection using an ELISA or immunochromatographic rapid test. And for chronic condition, you do a duodenal aspiration using a guided endoscope to collect trophozoite samples. Now the last one is what? A. You treat with what? Anti-protozoa drugs. You treat with anti-protozoa drugs. So I hope it all made sense and you all understood how we started from the introduction, where we talked about the different species of Giardia labia. The next thing we talked about who discovered it, which is what? Anthony van Leeuwenhoek in 1681. We talked about that too. We talked about the life cycle, how it is ingested. We talked about the morphology too. We talked about all these things. So I hope it all made sense to you and you understand all we have just talked about. So now if you are just joining my video for the first time, make sure to subscribe and turn on the post notification button so that anytime I drop any video, you'll be sure to be notified. Or you can also watch our other parasitology video for you to understand most of all this thing and the drugs. Also, for those doing pharmacology, you can also check our pharmacological video on the anti-protozoa drugs. It will help you to understand all this stuff. So the next one we'll be going into is what? Bacterium chloride. So stay with me throughout the course of all my videos so that you always understand everything I teach. Bye bye.